Northland, Deputy State Epidemiologist. Today we are reporting 22 new cases of COVID-19 in South Dakota. We have no new hospitalizations. 12 of these new individuals have recovered from COVID-19. There have been no new deaths, and we also have 376 new negative tests performed that we're reporting out. For our total case count numbers, this brings us up to 187 cases of COVID-19 in South Dakota. We've had 2 total deaths with 17 hospitalizations. 69 in total individuals have recovered from their COVID-19 infections, and there are no updates today for the community impact map. For the 22 new cases, I'll do the rundown by county, age range, and sex. So Brown County, 1 new case. Cottington, 2 cases. Lincoln County, 1 case. Minnehaha, 15 new cases. Roberts County, 1 case. Turner County, 1 case. And Yankton County, 1 case. The breakdown of age range for these 22 new cases, 4 individuals fall into the 20 to 29 year group range, 6 individuals in the 30 to 39 year group range, 3 individuals in the 40 to 49 year group range, 3 individuals in the 50 to 59 year group range, 4 individuals in the 60 to 69 year group range, 1 individual in the 70 to 79 year group range, and 1 individual in the 80 plus years of age group. 15 of the new cases are male and 7 are female. Again, for our totals, this brings us up to 187 positive COVID-19 cases in South Dakota. We are also reporting out a total now of 4,593 negative tests. And there are 3 high priority tests on individuals currently pending at the South Dakota State Public Health Laboratory. And that is the update on case numbers for today.
Okay, I'm going to go ahead and unmute the lines. You may need to hit *6 to unmute yourself manually, and we'll go ahead and open to questions.
This is Mark with the Black Hills Pioneer.
Go ahead, Mark.
2 questions for you. Dr. Anthony Fauci is now recommending state-by-state, statewide lockdowns. Has any guidance changed on that? Would be first question. Second question, there's sites that we know and trust for other items such as weather reports. Specifically, the Weather Channel's app is reporting drastically different numbers than what the state is reporting for positive COVID tests. Can you speak to how the state comes up with its numbers that it's given out on a daily basis?
Sure. This is Kim Elson-Reisen, Secretary of the Department of Health. On your first question about what Dr. Fauci was talking about earlier today, I would encourage you to tune in to the governor's press conference today at 1 o'clock Central Time for more information about those types of issues. Your second question about positive cases, the South Dakota Department of Health numbers are the accurate count of positive cases. By law, labs are required to report positive cases of coronavirus to us. I can't speak to what the Weather Channel has out there, but I can tell you that our numbers are accurate in that regard.
Thank you.
Next
This
caller.
is Paul from the Groton Independent. Question: they talked about the numbers, and before you had your numbers up, I compare yesterday's numbers to today's numbers, and they're different than what you actually gave us here today. So our numbers are not diving up on your website versus what you just said. Because you had Minnehaha County down for 15, and I only have them for 14, based upon your figures from yesterday.
We will look and make sure that the website is accurate, and if there is a problem with that, we will update that. Thank you for pointing that out.
Yeah, because I think you didn't mention Meade County having one, and
Okay.
the website shows having one.
So let me just clarify. What you see on the website is the cumulative to-date numbers by county. What we read off today are the counties for the new cases. So I
That's
think
correct.
that might,
And I
I think
compared
that might be what you're
yesterday.
seeing there.
I compared yesterday's snapshot to today's snapshots, and our numbers are different.
Okay.
We'll
Okay,
double check the
we'll double
website.
check, but if there needs to be a clarification, we'll make that on the website.
So that might explain why maybe one, like the Weather Channel, might be having some
Okay.
different numbers if they're going off of those.
All right, we'll clarify, and let's go on to the next caller.
This is Trevor
Can you
Mitchell with the
explain
Argus Leader.
The next Meade
Go
County
ahead,
case
Trevor.
and how that went up from what the
Trevor, go ahead.
So both yesterday and today, Governor Nome and also earlier today, Mayor Paul Tenhaken in Sioux Falls have talked about the possibility of a shelter-in-place doing something, pushing the peak infection rate down the road, and sort of pressing that as a negative or something that we don't necessarily. The idea that you can do too much too soon. And that's something that I think some of our readers have been confused by. I was wondering if somebody could talk a little bit about that concept.
Trevor, this is Kim Alston-Rice, and again, I would encourage you to tune in to the press conference that Governor Nome will be holding at 1 o'clock, and she'll have more information to share about those topics.
This is Morgan at the Rapid City Journal. There are now 9 cases in Lawrence County. One of them was a contractor for the jail and sheriff's office. So have any inmates, workers, or other contractors for the sheriff's office, have they tested positive?
Yeah, we can't provide details specifically on individual cases due to patient confidentiality.
Okay, are you able to say if any of the Yankton cases are related to the patients or workers at the Human Services Center?
No.
Okay, thanks.
Next
This is
caller.
Megan Rat with News Center 1 on Rapid City. Can you speak to the additional Meade County case listed today?
There's not an additional Meade County case in the new count today.
Correct. This is Dustin Arpon, Deputy State Deputy. Right. We are not reporting a new case in Meade County today.
The numbers, it listed 1 in Meade County, and now it says 2.
So there's 2 cases in Meade County and 1 has recovered. Is that what you're referencing?
No, I took a snapshot of the pictures before the update this morning, and it listed Meade County as having 1 and 1 recovered, and now it says 2 cases and 1 recovered.
Okay.
Again,
We'll check on that. I will say, investigations are active, and as we acquire new information on cases, sometimes we learn of new for people's counties.
Hello, Troy.
This is Stephen Grubbs from the
KXLG
AP.
Radio in
I
Watertown.
have a question.
we'll go to Steven first.
I was wondering, and this might be for the future, but if it would be possible to get the median ages of those who have recovered, those who have been hospitalized, and those who have died.
Thanks, Stephen. We will take that under consideration and see what we can provide in that regard.
Thank you.
Next question.
Troy Van Dusen at KXLG Radio in Watertown. The 2 additional cases in Coddington today, are those community spread? Can you advise?
Yeah, we are not reporting any new additional community spread cases to our impact maps for today.
Next question.
Yeah, this is Trevor Mitchell with the Argus Leader.
Go ahead, Trevor.
Yesterday at a White House press conference, Jared Kushner talked about the Strategic National Stockpile being a federal stockpile that was, quote, not supposed to be the state stockpiles that they then use. Some language on the Strategic National Stockpile website was then altered. Do you know, I know talking with you guys recently, you have gotten deliveries of PPE from the stockpile. Have you been informed of any changes in there as no longer being able to get stuff from there?
Thanks for that question. We continue to make requests, for available supplies. We have not been notified that, that we're not going to be able to access those materials, although we do understand, as you just indicated, that at the federal level, the supply level is getting low. We have never solely relied on the National Strategic Stockpile for our supply needs, and so we actively seek out, the purchase of those supplies through other vendors and private means.
Thank you.
All right, we have time for
Jackie
one more
with
question. Public Broadcasting, go ahead.
Thanks. I'm wondering if you can explain what is stopping you from releasing places of employment of these cases. Is that included in HIPAA, or how does that relate to what you're able to share?
So again, we do robust and complete investigations with each positive case. That allows us to identify potential close contacts and work with those people to take appropriate precautions, monitor symptoms, get tested if needed. If there is a situation where an individual came into close contact with members of the public that can't be identified, then we would release information about that potential exposure. That could be related to an employer. It could be related to a public event. We've seen this happen in other states where a person's been, at a basketball game, and you couldn't possibly know all of the potential close contacts. So that's the process, and we will continue to use that.